Hi, I'm Dr. Tieche, and welcome to the first installment in MedMinute with Dr. Tieche. In this forum, basically what we're doing is accepting questions from our patients or from anyone in general about topics that are of interest to them regarding healthcare, things that we do, anti-aging stuff, life improvement, and things like that. So we have some questions, and I was going to start that we received. The first question is, what's the difference between Tesamorelin and Sermorelin? That's a really good question because Tesamorelin has become very popular lately. Both of those, as others, are what are called growth hormone release peptides. And what does that mean? Well, peptides are basically a molecule that's a group of amino acids that stimulates a receptor to get a desired response. For example, insulin is a peptide. These peptides are specific that they will stimulate the pituitary, that's a gland in your brain, to release growth hormone. Growth hormone is a hormone that tends to drop as we get older, and what happens is we start losing some of the benefits of it. Some of the benefits are we notice changes in our skin, decreased elasticity, decreased muscle mass, more subcutaneous fat. These are the things that are associated with aging. And we look for things that are anti-aging stuff, we tend to gravitate towards growth hormone. And really it's just optimizing it to back to levels of what they were when we were much younger. So peptides do that, and there's several different types. There have been lots of revisions of them. One of the first ones that came out was Sermorelin. Sermorelin is one of those growth hormone release peptides that, again, stimulates the pituitary. It releases growth hormone periodically throughout the day, and it does it in what's called physiologic doses, what would normally happen to us when we were younger. So it's very natural. The nice thing about Sermorelin and why people like it, it has the strongest anti-aging effect on people. So in other words, it really helps our skin. It does improve muscle tone. It does help with joints, things like that, mental clarity, and it does help get rid of some subcutaneous fat. It helps stimulate the collagen and elasticity in our skin. It was one of the earlier ones. It has a lot of recognition. Then Tesamorelin is a newer one. It's a much larger peptide. It's about twice the size of Sermorelin. And it's a little bit different in that it's kind of a little bit stronger. And so really, and they work differently than each other. Tesamorelin is probably best known because it stimulates more muscle mass much quicker than Sermorelin. Sermorelin typically doesn't kick in for about 30 days before people start noticing it. Tesamorelin is generally in the second week. They start noticing increased muscle tone. But one of the big differences and what people love about Tesamorelin is getting rid of subcutaneous fat as well as visceral fat. And if you don't know what visceral fat is this. It's your gut. And so people will diet, particularly men will diet. They'll get rid of a lot of the subcutaneous fat, so they'll see their six-pack, but their abdomen still sticks out. So getting rid of that visceral fat is a huge thing that most people struggle with. So Tesamorelin is stronger for that. As far as how you feel on it, you're not going to feel any like something abrupt that it's stronger that way. It's just more of the results that you're going to notice. More reduction in that subcutaneous fat. What that's going to mean is your muscles are going to be much more clearly defined. Get rid of that fat in your abdomen as we discussed. Also, increased muscular growth to exercise. So it's really a nice thing to add on to other things, maybe like testosterone. But it definitely enhances workouts. It definitely helps with mental clarity. It really does help with skin. If you look at some other comparisons, Sermorelin probably is a little bit better for sleep. Sometimes people are taking the growth hormone to help them sleep. Tesamorelin is okay with that, but really, if you were to look at the two, it really depends what you want. If you just purely want anti-aging benefits for your skin and overall appearance and general quality, you're probably going to use Sermorelin. If you're someone who is working out, wants to improve your muscle status, wants to lean down a bit and have more response to that, you're probably going to lean more towards the Tesamorelin. Now, how are these things administered? Well, all peptides are administered by subcutaneous injections. Generally, the frequency of those injections is 5 out of the 7 days a week. In other words, you only do it that many. You don't have to take it every day. If you wanted to, you could, but there's kind of a ceiling effect of what you're going to notice from it. That's about typically what people do. They can be taken for many months, sometimes even years if you wanted to, for that, just because they have such nice anti-aging effects. The main worry that we always worry with any of these peptides or even growth hormone is getting the growth hormone level too high. And what would happen with that? Well, that could impact your blood sugar. You could start having bony overgrowth, all sorts of things like that. That does not happen at all with peptides, even if you adjust the dose up, because there's a ceiling effect on the receptor stimulation and really the amount of growth hormone it will release. That's why we like them, because they're going to target right what we want, and it delivers it right to the level that we want, and the benefits are very predictable. So again, looking at the two of them, it really is just depending on what you want. There are other peptides that do that too. There's Sermorelin, there's CJC1295. They all have very weird names, but they all do the same thing as far as stimulating that receptor to release growth hormone in a physiologic way. That means it's pulsatile. It's going to be releasing it several times throughout the day. They generally all help quality of sleep. They all improve quality of sleep, for sure. And when you look at people, actors most notably, and why they seem ageless, is that most of these people are using them. And a lot more people, they are using them generally worldwide, because as we get older and our society is older, we don't want to look it. We want to keep our looks about us and still feel good. So these things accomplish it with very minimal side effects at all. They don't raise your blood sugars. They don't cause any abnormalities in liver functions or kidney functions at all. Sermorelin, on the one hand, can cause a little bit of flushing when you do the injection. So sometimes you'll feel a little bit of a whoosh when you do it. Sometimes that's very temporary, but that goes away. Tesamorelin, on the other hand, does not do that. And so that's one of the little nuances. It's not really a make or break deal for most people. It's one of those things that we just want to notify people of. So that's really the big difference between the Tesamorelin and Sermorelin. I really appreciate that question, and that's all I have time for today. I'd like you to go ahead and submit your question down below for further topics that we're going to talk about next Thursday at this time.